right, let's talk about diabetic retinopathy. This is a big one, especially for you endocrinologists, because now, with retinal photography showing up in your clinics, you're on the new front line. You have a huge opportunity to help save your patient's vision.
So picture this. You're with a patient, you snap the image, and this pops up on your screen. You can see, well, you see something. Some spots, maybe some weird lines, but what does it actually mean? Is this a routine thing, or do you need to get your ophthalmology colleague on the phone like right now? It's that moment of hesitation that we are going to clear up today.
Look, we put this explainer together for a simple reason. You've got this incredible new tool at your fingertips, but let's be honest, the reports from ophthalmology can be a little confusing. All those terms like hard exudates, cotton wool spots, or macular edema. Our whole goal here is to turn that jargon into clear, visual patterns so you can look at an image and know exactly what to do next. And let's not forget what's at stake. Early diagnosis is everything when it comes to preventing vision loss from diabetes. It's the single most important thing. Your ability to spot these signs early on can literally save a person's sight. You're in a powerful position to change their entire future.
Okay, so before we can spot what's wrong, we have to get really good at knowing what's right. You gotta master the normal. Recognizing a problem always starts with having a rock-solid picture of a healthy retina in your mind. This is our baseline.
So let's start right here. This is our reference point, a perfectly healthy retina. Pay attention to the blood vessels. I want you to think of them as clean, perfectly paved highways. See how they branch out, all smooth and clear? Everything is organized and looks pristine. This is what we're aiming for.
And on this map, there are three main landmarks you need to know. First, the optic disc. That's the bright circle, basically the on-ramp for the optic nerve. Then you have the macula, that slightly darker spot in the middle that gives us our sharp central vision. And of course, the vessels, our smooth, consistent highways. Keep that highway analogy in your head. It's going to come in handy. Okay, we've got our baseline down. Now let's start looking for the first hints of trouble. These are the really subtle clues that tell us that the damage from diabetes is just beginning to show up in those blood vessels. The absolute earliest, most fundamental sign you're going to see is a microaneurysm. Just think of it like a tiny, microscopic bubble forming on the wall of one of those small vessels, the very first sign of weakness. What you're looking for visually are just tiny, little, distinct red dots. They're not dramatic, but they're the first whisper that something's wrong. All right, take a look at this. This is mild non-proliferative diabetic retinopathy, or NPDR. Just scan around the image. Can you spot them? There are a few scattered, tiny red dots. See? They're small, easy to miss if you're not looking. But finding these is the first big step. For a patient like this, the plan is simple. Keep screening annually and really double down on controlling their sugar and blood pressure.
Now, as things progress into moderate NPDR, those vessels start getting even leakier. And now we're looking for three key signs. First, those tiny red dots get bigger, becoming what we call dot and blot hemorrhages. Then you'll start to see hard exudates. These look like little yellow, waxy specks. That's actually lipid leaking out. And finally, you might see cotton wool spots, which look just like they sound, little fluffy white clouds that signal a lack of oxygen.
Okay, check this one out. See those yellowish, waxy-looking spots? Yep, those are the hard exudates. And notice the red spots are a bit bigger now, more like blotches than tiny dots. Our smooth highways? They're starting to get potholes and oil spills. This patient needs a closer eye on them, maybe a follow-up in 6 to 12 months. All right, let's pause here, because we're about to shift gears in a big way. The stages we're going to talk about next aren't just about monitoring anymore. We are officially moving from a warning sign to a potential emergency. Seeing these features means the risk of serious vision loss is jumping up dramatically.
For severe NPDR, you've got this fantastic little tool, the 4-2-1 rule. If you see just one of these things, it's time for an urgent referral. 4 stands for serious hemorrhages in all 4 quadrants of the retina. 2 is for venous beading in 2 or more quadrants, and I want you to remember this visual. The veins start to look like a string of sausage links. And 1 is for IRMA. That's a jargony term, but it's another vessel abnormality in at least 1 quadrant. But seriously, that sausage links visual, burn that into your brain.
And this image shows you exactly what to hunt for. Look at the top left. See how that vein isn't smooth anymore? It kind of pinches and bulges and pinches again? That's it. That's venous beading, our string of sausage links. And over on the right, that's IRMA. These are both massive red flags that the retina is getting seriously starved of oxygen. You know what? Let's just stop for a second and really soak in this contrast. On the left, you've got the early stage, a few polite, tiny red dots. Contained. Subtle. Now, look at the right. That is proliferative diabetic retinopathy. It is anything but subtle. The organized highway system is gone. It's been replaced by this wild, chaotic, tangled mess of new blood vessels. It almost looks like a delicate but very dangerous lace pattern has been thrown across the retinal.
This chaotic web is called neovascularization. It's what happens when the retina is so starved for oxygen that it starts to suffocate. It's a desperate, last-ditch effort to grow new supply lines. The problem is, these new vessels are weak, they're fragile, and they bleed like crazy, which can lead to sudden, catastrophic vision loss. When you see this pattern, it's not urgent, it's an emergency. So, we've walked through the whole journey, from a perfectly healthy retina all the way to a true emergency. Now let's put it all together into a super simple, actionable cheat sheet that you can use in your clinic to decide exactly when it's time to make that call.
Here it is, your go-to guide. If all you see are those tiny red dots, you're in mild territory. That's a routine follow-up. If you start seeing bigger red blobs and that yellow, waxy stuff, it's moderate. Time to monitor them a bit closer. The second you spot those sausage-link vessels, think severe NPDR. That's an urgent referral. And if you see that chaotic, crazy lace pattern, that is PDR. That's an emergency referral, no questions asked.
But before we wrap up, I have one last rule for you. This is the pro tip that overrides everything else. I call it the Macula Rule. I don't care what stage the rest of the retina looks like. If you see any of those yellow, waxy, hard exudates anywhere near the macula, the dead center of their vision, that patient needs a referral, period. That's a sign of diabetic macular edema.
And here's a perfect example of what I'm talking about. See that clump of yellow stuff right near the center of vision? Even if the rest of the retina looked pretty good, maybe just mild disease, this one finding changes the entire game. Any swelling in the macula is a direct threat to their sharpest vision, so this patient has to see an ophthalmologist. When it comes to leaks, location is everything.
So let's go all the way back to that first image, that first moment of uncertainty. You've got the picture on your screen, but now it's different. Now you have a framework. You can tell the difference between a healthy highway and the first few red dots. You know what the yellow waxy leaks mean. You know to look for those dangerous sausage links, and you know an emergency lace pattern when you see one. You know the rules. You know what you're seeing. The only question left is, are you ready to make the call?